Hey guys, happy Friday. I'm here for the weekly Facebook Friday Live, or Friday Facebook Live. You know what I mean. Anyway, I'm Dr. Jennifer Greer. I'm a plastic surgeon in Cleveland, Ohio. And Friday is when I get on Facebook Live and I answer reader questions. Now, of note, I usually do this at 3 p.m. and it is 3:01, so we're on time today. Next week, I'm going to be going online at noon instead of 3. We are driving up to Michigan for my 20th high school reunion. So if you ever wondered my true age without all the Botox and fillers, you can calculate it based on that. All right, so we've got a couple viewer questions today. First question is, how do you treat the crepey skin over arms and legs? That is an area where skin tends to get that little fine, wrinkly, crepey texture. And it's just one of those things that happens with aging, even if you've never lost a ton of weight. There are a couple of ways to treat it. None of them are exceptional, but there are options. Now, first, if you have a lot of extra skin because you've lost weight, then you're looking at skin removal. So we're just talking about that crepey texture today. And for that, you are really looking for a skin tightening procedure. Now, in my office, I offer Skin Tight, literally is what it's called. That is mostly used on the face and neck. I've had some success in the upper arms with it, but the biggest issue with Skin Tight is the amount of time it takes to heat up an area. So it gets kind of time intensive for large areas like the legs, and it's 6 treatments, so that time really adds up. Now in small areas like just, around the elbow, I've had pretty good success with that. Skin Tight is done with a broadband light device, so similar to a laser, but not exactly the same. Basically, we run the handpiece over the area of skin. It heats up. We keep it at temperature for about 4 minutes, and at temperature is about 100 to 102 degrees, so like the temperature of a really warm hot tub. And then we move to another area. Treatments are done 2 weeks apart, total of 6 treatments. The heat stimulates collagen expression, which is the tissue or the protein that gives skin its elasticity. So more collagen means better elasticity. Results are gradual. You see them over about 3 to 6 months. So that's the one I offer. There is a more effective treatment on the market. It's called Body Tight. And it actually is a radiofrequency probe that goes under the skin to heat it up. So it is a more invasive treatment. It does mean some sedation and some numbing medication like you would get with liposuction. The results are more dramatic than what I can do with Skin Tight though. So if that is something you're interested in, it's Body Tight, T-I-T-E. I don't know who's offering it in Cleveland yet. It was something I had looked into for my practice about a year ago, and I've heard good things about it from my co-plastic surgeons. I don't have any personal experience with it. So those are the options for now. Like I said, no home run options. It's kind of one of the sucky parts of aging. All right, the second question that I'm going to talk about today is, what is the recovery like after tummy tuck? First, I want to differentiate cosmetic tummy tuck from skin removal after massive weight loss. Although the incisions are the same and the procedure is very, very similar, the healing is different. With massive skin removal, much higher likelihood of wound healing problems, and the recovery is usually a little bit harder. So right now I'm just talking about cosmetic tummy tuck. For cosmetic tummy tuck, what happens is incision very low down, right about the bikini line or a little lower, and the skin is lifted up all the way to your ribs. Lifting that skin up gives me access to your abdominal muscle, and then redrape the skin and take off the extra. So that's a lot of space where the skin has been lifted up off the muscle wall, and fluid can collect in that dead space. I do a lot of internal stitches to help bring that down, but I do leave it drain that stays for about a week. Sometimes 2 drains, usually just 1. Now for skin removal patients, the drain stays longer. For a cosmetic tummy tuck, you're looking at about a week with a drain. The drain's a nuisance. It's kind of uncomfortable. It tugs a little bit. You got to tuck it in your pocket or safety pin it to your clothes. But it helps prevent fluid collections. Some people are doing a drainless tummy tuck. They just use even more quilting stitches. And that's something I'm kind of gradually moving toward. The risk of not having a drain is that you'll get an internal fluid collection that we then have to drain in the office. So not a huge risk. The drainless tummy tuck, though, of note, is generally limited to patients with a BMI of 30 or lower. As the BMI goes up, the risk of fluid collections, that being seromas, goes up. So there aren't a ton of surgeons who will do a drainless tummy tuck with a higher BMI. In fact, I don't know of anyone who does, although everybody's got their own criteria. So the drain is kind of the big hassle, and that generally determines when you go back to work. Most people do not like to go back to work with a drain, although if you're doing a strict office job, you can. It is a procedure where you go home. It only takes about 2.5 hours, so I send everybody home the same day. And your muscles are going to feel really tight and you're going to feel pretty sore. You will also be in a compression garment and abdominal binder, and that will be on there. Sorry, I was getting a low network connection, but it's back up. If I looked spaced out for a second. So anyway, when you go home, you have a compression garment and an abdominal binder on to help decrease swelling. And you'll be wearing those for about a month. And after that, maybe just at night, maybe not at all, depending on your swelling. They're there, they just kind of help support your abdominal wall while it heals and decrease swelling. So total downtime, expect about a week off of work. You will be on narcotic pain medication for probably 3 to 5 days. It kind of depends on you and your pain tolerance. So if you've had prior surgery, you'll know. I generally only prescribe Norco, hydrocodone, and that is plenty for patients. I also do Celebrex ahead of surgery. So you start taking that the night before and then take it the first 3 days after. Celebrex is an anti-inflammatory, which is great because decreased inflammation means less pain. And it's one that doesn't increase the risk of bleeding like Motrin does. So Celebrex beforehand, home with Norco, and I also do what's called a tap block. Basically, I inject numbing medication along the nerves on each side of your stomach. So that helps for the first night as well. After that, you're up, you're moving, you're sore, coughing hurts. That's about it. You're gonna feel back to normal and like yourself after about a month to 6 weeks, but really the first 5 to 7 days are the worst. After that, your skin will feel kind of numb and it may feel itchy just because all of those sensory nerves were cut when we elevated the skin. That sensation will come back, but it does take a few months to do that. And you'll have swelling that can take about 3 to 4 months to completely go down as well. You'll need to take about a month to 6 weeks off from any heavy lifting, so nothing more than about 15 pounds, because that muscle repair is going to be stressed if you lift heavy stuff, right? You tighten up your core, or you should, when you lift something heavy, and that can tear the muscle repair. So really nothing that you can't lift with one arm. Easy in terms of cardio, so no heavy cardio like running or elliptical or bike. Walking is fine, but anything more aggressive than that is going to increase pain and increase swelling. So about a month total downtime, about a week off work. Now for skin removal surgery, it's going to be more for both of those because the pain's usually a little bit more. The drain often stays a little bit longer. So if that's something you're interested in, come see me. I can give you a detailed treatment plan and help set expectations of what your recovery is going to be like. Thank you guys for your viewer questions today. Again, we will post next week. You'll see the blue graphic go up Wednesday and Thursday. So if you have any questions or any topics you would like to hear about, please write them in the comments and I will answer them on the live video. And again, I'll be here early next week at noon. I hope you guys had a wonderful 4th of July, and I hope it carries into a wonderful 4th of July weekend. Take care, and I'll see you next week.